Good afternoon and welcome to the daily briefing at the St. Clair County EMA office, where I'm joined with Chairman Kern and our good friend Sam Bierman from the Health Department. Sam, the numbers come in today up and down. It's higher numbers than we've seen for a while.
It is, and as far as the amount tested, we are setting a record today. So as of today, 37,254 St. Clair County residents have been tested, which is an increase of 1,046, which, as we said, is the largest one-day test result that we have had. We are at 4,015 positive test results, which is an increase of 108, and that does include both males and females from under the age of 10 up to their 70s. And for our daily county positivity rate, we are at 10.3%. We are at 33,239 negative test results. And unfortunately, we are adding an additional death today, which does bring our total for St. Clair County to 155. That was a male in his 90s who did have underlying health conditions. And as always, we send our sympathies out to his family. For those who have completed their IDPH required 14-day quarantine period, we are at 2,941. And for state totals, we are at 2,806,797 that have been tested, with 183,241 positive test results, which is an increase of 1,298 from yesterday. For deaths, we are reporting 7,526 for the state, which is an increase of 10 from yesterday. For our hospitalization numbers, these are for hospitals that are in St. Clair County. Currently, we have 50 patients that are admitted due to COVID-related reasons, and 2 of those individuals are on ventilators. Some good news today that we have is that we are adding no new additions to any of our long-term care facilities or congregate living facilities in outbreak status, so that's always a good day for us. One thing that I would like to point out, several weeks ago when we were talking about our high positivity rates, we did get some comments that people had said that if it weren't for long-term care centers in our county, that our numbers would be fine. We have not had a fraction of the increases in our long-term care facilities for about the past week, and as we can see, the numbers are still going up. So it's clear that it is community spread and it is outside of the walls of long-term care facilities. And a breakdown, as we have been talking about in the past several days, it's the younger age groups that we are seeing test positive. So in our numbers today, the 1,046 results that we saw and the 108 new positives, 5 of those individuals were under the age of 10 years old, 18 of them were in their teens, 15 of them were in their 20s, 14 were in their 30s, 16 were in their 40s, 19 in their 50s, 15 in their 60s, and 6 in their 70s. So the numbers don't lie. You can see we are certainly trending down to a younger age group that we are seeing positivity rates for. So now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we'll move into the zip code report at this time. These are COVID positive diagnoses in these particular zip codes in St. Clair County. In 62059, we remain today at 11. 62201, we go up by 1 today to 186. 62203 goes up by 1 to 152. 62204 stays the same at 115. 62205 goes up by 2 to 150. 62206 goes up by 4 to 343. 62207 remains the same today at 201. 62208 goes up by 5 to 254. 62220 goes up by 6 today to 330. 62221 goes up by 5 to 352. 62223 goes up by 3 today to 176. 62225 goes up by 1 to 17. 62226 goes up by 3 to 412. 62232 goes up by 1 to 84. 62239 goes down by 1 today to 45. Remember, they go down. If there's a change in zip codes, somebody registers one way, reports back to another zip code, we go down because we go up. And so we want to make sure that we have the most accurate zip code numbers that are available to you. 62240 remains the same today at 14. 62243 goes up by 1 to 27. 62254 goes up by 1 to 121. And 62255 remains the same at 13. 62257 stays the same at 22. 62258 goes up by 1 to 62. 62260 goes up by 2 to 51. 62264 stays the same at 68. 62269 goes up by 8 today to 283. And 62285 stays the same at 37. So all last week we talked about, we had guests on to talk about schools, and you have been out there. Team St. Clair's been requesting their favorite school districts get on the program, and so today Matt Steins is here today. He's the superintendent with Grant Illini, District 110. So thank you for being here today.
No problem. Thank you, Chairman Kern. Pleasure to be here.
Well, it's great to have you. So you've been working hard, putting a plan together. Why don't we just dig in? What do the students have to look forward to in the fall?
Well, working hard, that's an understatement for myself and all of my colleagues. So what's really happened behind the scenes is putting together multiple plans. Because as you guys know, with your numbers, everything changes daily. So I'm going to say, as of today, August 3rd at 3:30 p.m., here's the plan. The way it looks for Grant Illini, and keep in mind this plan is based on parent surveys that we conducted, work with our union leadership and our teaching staff. They've been phenomenal, and then myself and the Board of Education. And what we found is our community predominantly wants kids back at school. So those surveys we did back in June showed us about 68% said, yeah, I'm sending my kid. We had about 26% on the fence. They were like, hey, I'm a little nervous, let me see what this looks like. And then we had another 9% that, for whatever reason, said, nah, I think my kid needs to stay home. So where we sit is right now registration, we have about 77% of our kids coming back, about 22% on the remote side. So what that'll look like, in any given class, we'll have regular school. And I want to reassure everybody that we've been following the guidelines through IDPHS, through County Health Department, through the state, American Pediatrics, all the experts. So desks are spread apart. We're keeping that 6-foot distancing. All kids are going to be required to wear a mask. Staff will as well. I've been getting used to wearing mine as well, even though I don't have it on right this second. We've got extra cleaning schedules in place. We've got sanitizing stations. You can't throw a rock without hitting one. And everything in place, along with assigned seating, cohort grouping, to make sure our kids can stay safe so that we know who the kids are around and that we can control what that movement looks like. So when a kiddo comes to school, it's going to look a little different because of the safety precautions, but overall it's going to look just like school. For the kiddos on the remote side, it could be one of two things. So predominantly what we're going to do is our teachers are good with live streaming their classes. So unlike the spring where you maybe got your assignment on Monday and it was due back by Friday, do it at your own pace, we're going to ask the kids to be logged on, engaged in the classroom in a virtual live stream. We're going to use Google Meet for that platform. So if you're teaching the class, Mark, you're going to be up in front of your chalkboard, God, that dates me. You're going to be in front of the whiteboard like you normally would be, or up at your smartboard. And as you're doing the lesson and talking to your kids in class, the kiddos remotely can see you, teacher can see them, and they can engage just like they would if they were sitting there. Really cool thing that the technology allows us to do. So I'm excited about that. Now we do have a couple grade levels where they're really heavy remote, so we may deviate from that a little bit. Fourth grade's one, for example, that we have enough kiddos on the remote side that a whole class will be remote. So that may not be the live stream. We may just assign a teacher to that. So they may vary that schedule a little bit, but predominantly kids are going to be in school virtually from 8 to 2:30, just like they normally would. So
Wow, sounds like a plan. In a couple of the districts and what we've heard on the news, in some areas the teachers are saying, hey, we don't necessarily want to go back. you've pulled your teachers too, and I guess if there are ones that have health concerns, you take care of those. But
Yeah, of course, the staff safety is important as kids' safety. We don't want anybody to feel uncomfortable about being there. We certainly don't want anybody to get sick as a result of coming to work, in their case. The union's been great to work with, and they have pulled the staff. And I won't say there's not concerns. And I do have some folks that are nervous. I'm a little nervous too. Want to make sure everything goes as well as possible. But predominantly our teachers are good with coming back. We do have a couple staff members that have reached out and they've said, hey, I've got some stuff, Matt. There's some conditions. I'm not going to be able to do it. And we've certainly accommodated them as we needed to.
so in the spring, you were thrown into this. Curriculum was really kind of set based upon kids coming to class, and so it was probably hard to translate that to remote learning. Do you think the lesson plans have been amended and changed over the summer so that kids are going to get a different experience?
Yes, sir, I do. So I affectionately said the spring was a really great experiment in what remote learning could look like. And it truly was. We did our best and we tried different things and we waded through to see what worked. And what we learned is what worked well and what really didn't work well. And then I'm very proud of my staff, the folks that have stepped up over the summer and gone out and sought out that additional resource, additional education on how can I do remote learning better. So I fully expect we're going to come back and do it much better than we did in the spring. Now, I don't think anything replaces being in the classroom with your teacher and all the things that go along with school besides curriculum. But I think we're going to do it much, much better than we did in the spring. And I think folks that opt for remote will see a much truer school experience than what they saw last year.
How about extracurricular activities? Chorus, band, any clubs?
Yeah, unfortunately, we're all dealing with the phases and the guidelines and the groupings and all those metrics. And at this point, we're not in a position to where we can make those extracurriculars happen. Grand Illini is part of the Belfair Conference, and it's mostly local Belleville grade school districts together on that. And we made a decision collectively a few weeks back that under the guidelines, under the protocols, we just couldn't guarantee kids' safety because we didn't have the supervision and all that in place. So for right now, that stuff's on hold. Certainly we miss it, and certainly we want to see that back. But we're going to get together again in September, and hopefully the numbers are better, and by then we can reassess and maybe just miss baseball, softball, soccer, and be ready to kick off basketball in October. That would be a best case scenario. So we'll see how it goes.
So are you operating kind of on a quarterly basis?
We are. So, with the numbers changing as rapidly as they do, it's hard to long-term forecast. So particularly for like my kiddos that chose remote, and even the ones that chose to be in school, we've asked them to go a quarter at a time. That if you chose remote, you're going to be remote the whole first quarter, because we need that time to build schedules and ensure things are right. So that'll be the point they can opt out. And we've kind of, amongst the soups, we've talked about that as far as our extracurriculars and those additional school things that we bring back in. That let's go a couple months at a clip and let's see where we're at.
How about meal program? Are you going to have a cafeteria? Are kids going to eat in the rooms? How are you going to handle that?
So a little bit of both. And actually, I should say a little bit of all three. So when we went remote in the spring, all the schools continued to provide prepared meals for kiddos, either on a delivery or a pickup basis. And then as we come back, we're dealing with the class size restrictions and the group restrictions. The way it looks for me is we're going to have kids eat breakfast in the classroom. And a lot of that is because scheduling kids as they arrive at school in the morning is hard to do. Buses come at different times, then mom and dad drop them off, and the kids that walk to school, they may stop at the gas station on the way in, and you can't judge what time they're going to be there. So we're going to ask kids to come in the building, and when they get there, they will be screened. I should mention that. We'll do the temp check, we'll do the symptom check when they come in. Once they enter the building, they'll go to the cafeteria, they'll grab their breakfast, which will be a grab-and-go type format. They'll go straight to their classroom. That will allow us to prevent that cross-contamination, that cross-mixing of our cohort groups, and get them in the place where they're supposed to be so that we can control their safety. And then from there, lunch we are going to do in the cafeteria. So the way our groupings are shaking out, we can get everybody in the cafeteria space. We can have them at different tables spread out to where there's an adequate distance, and then we'll serve them very similar to what they saw before. It will be kind of a grab-and-go format because it's much like a Chinese buffet in a way. You can't have those open containers and come through and I want this and this. So it'll be a one type of prepared lunch. They'll grab it, they'll go sit back down, they'll be ready to eat lunch, and then go out to recess like they normally would. For our kiddos that are remote, particularly our families that qualify for free and reduced lunches, we will still provide a curbside pickup, and we'll get detailed times out on that, but we'll have a window of time that you can pull up to the curb. We'll have staff out there. We'll give you your breakfast and lunch for the day, and then we'll do that on a regular basis as well.
What about start and finish times? Pretty much the same as normal?
Yeah, that's one of the things I'm really happy about is that for the most part, we've been able to preserve our normal school times. So Monday through Thursday, it'll be times as normal, which the elementary building will be roughly 8:15 to about 3 o'clock, and then the middle school will be 7:40 to about 2:20 on dismissal. Friday's the only day that we're switching up a little bit. We are going to dismiss about an hour and a half early on both those days. The middle school will get out at 12:15. The elementary will get out at 1. Because of the extra supervision and time we're losing in the prep and the admission to school and screening and all that stuff, we lost some of our time that we used for like collaborative meetings or professional development, IEP meetings, stuff like that. So we wanted to get a little of that time back to where we can still do those essential functions.
So you're taking a temperature when the child enters or when the student enters the school.
Yes, sir.
What happens if they're above the, I assume it's 100.4?
100.4, that's the magic number. So if a kiddo does test, and we'll tempt them a couple times. I kind of chuckle about it when Susan hosted a meeting a while back. They had to tempt me 3 times before I was cleared to come in. I spent too much time standing outside talking to somebody else, I guess. So we'll tempt them, and if they do run a little high, we'll ask them to sit down. We'll let them cool off for a minute. And I really worry about like my kiddos riding their bikes to school.
Right.
I'm sure they're going to be 100.4 better in August when you rode your bike, a half a mile to school. So we'll let them cool down. We'll check them again. If we find after a couple screenings they're still high, then our school nurse will intervene. She'll do a regular oral check with I won't say more accurate, but maybe a more reliable thermometer. And then from there, we'll make a determination. If we do find that the kiddo is running symptomatic with the temp, then we're going to ask that they not attend school that day. We'll isolate them from the rest of the kiddos. We'll call mom and dad and have them come pick them up in a hurry. So,
sounds like you've thought of everything almost.
oh, hey, I appreciate that. We've tried. I have an incredible team out of Grant, and everybody's just been all hands on deck. And we've tried to think of every scenario possible. Come August 10th, I'm sure I missed something, but we're going to do our best.
Doesn't sound like you got much of a break this summer.
Not much. It's been pretty busy all summer long.
Well, next summer you'll be able to
Next
take
summer.
double time. Herb had a break yesterday. He had a vacation day. Herb, y'all rested?
Oh, yeah. Nervous. I was glad to hear, Matt, you made that comment about, you're a little nervous because every day when I'm waiting for the numbers to come in, I'm really nervous. So I'm glad to see that you're taking it serious just the same as everybody else is. And I want to applaud your teachers. I know you've all got thrown into this thing and nobody could have predicted this. So it's going to be a chore, I can tell you that. One thing, a safety plan, for the kids that are in school that chose to be there. If worst case scenario, have you got any type of plan in place to deal with that?
Yes, sir. So we've been working with the county health department and following some of that state and legal guideline on that. So yes, we have plans in place that if we do unfortunately have a case that pops up to where we need to react, then honestly I'm going to work with the professionals and we'll defer to the county health department on some levels. But they've given us pretty good guidance on what that looks like. And that's why the classroom situations, the bus situations, the assigned seating is so imperative. Because you guys know from doing this on a county level that contact trace and that who was within 6 feet for more than 15 minutes without PPE on, that's imperative that we can talk about which kiddos or which staff may have been in contact so that we can address that.
Now, one of the questions that I saw, fire drills, will there be any of that stuff still going on that they normally have? How will that be handled?
Well, there's this boss lady for the county that makes me turn in an annual report, and I can pick on her because she's sitting over there. Of course, we're still going to do the normal drills. They are probably going to look different, and for example, we've always got an October drill for the fire department. It's Fire Prevention Week. And I don't anticipate the fire department coming in this year and doing the big presentations like they used to. We just won't be able to do that. So we'll probably look at smaller groupings, maybe hit a classroom at a time. And we've talked about the idea of tabletop exercises for fire drills for the first quarter. And then hopefully when things ease up, we'll do the physical walk out the building. But no matter what, we're going to make sure that kids know what the drill looks like, where they're supposed to be, how they're supposed to respond. And we can do that in a simulated thing. We even talked about, even though we spread out 6 feet and it would look a little different, we talked about the staff doing a video fire drill that we could just show and say, here's what it's supposed to look like, guys. So we will certainly do the drills on some level. Bottom line, the kids are going to know, and we're going to make sure that they have that expectation.
Very good. Brian, was there some other questions?
There was just one thing that hasn't been touched on, or there's some additional clarifications requested. As far as the 6-foot social distancing, how do you see that maintaining in a recess type environment?
Yeah, so that might be the hardest thing in the world, especially when you talk about kindergarten kiddos that like to run around and play tag and do that stuff. So recess will be very directed, and we'll have the kids into groups. So we're going to make sure they stay in those cohort groups, and then we're going to assign areas of the playground area where they can be. So one of the questions parents asked me at the board meeting was, what about recess equipment? So if you take my 3 first grade classes, one might be on the basketball court one day, one might be on the recess equipment, and one might be on the soccer field. And that way those groups are spread out. As far as that 6-foot distance, that's where you got to teach kids and let them know the expectation, and then remind them when they're not following those rules. So we will have staff at recess. They are all very aware of the rules that are going to be out there and the guidelines, and we're going to ask the kids to comply with that. You know, I've learned that kids are great, and typically when you set an expectation for kids, they'll meet that because they're pleasers. They want to make people happy. They want to do the right thing. And I firmly believe that they'll do that to make sure they can still be part of that recess program and part of school and get to hang out and feel a little normal.
Okay.
Very good.
Thanks, Matt.
Thanks. Appreciate it.
We appreciate you being here. Great job.
Well, another great guest answered some questions. Seen quite a few of them coming in there, and we'll try to get the answers to them if we didn't get to them there. As we started off, 108 tests more positives from yesterday, and as we pointed out, a record high as far as the amount tested. So that's kind of what we expected. Our daily county positivity rate 10.3, the region 7.3.
Still way too high. We shouldn't
Yes.
be above that 10% level.
We want it down lower, and as we say each and every day, it's all of us have to do that. It's not one person. It's not Team St. Clair by themselves. It's everybody individual. I said it the other day, the businesses, not just the restaurants and the bars, but every business out there, there's not a day goes by we're not getting calls here at the EOC of some citizens saying that business, they went in and they didn't have their mask on, or I was standing in line and people behind me didn't have their mask on. And that's where I think it takes every individual, every citizen. If we want to get behind this, get this thing behind us, we've got to step up to the plate. For you ball people out there, it was just said before we went on the air, 4 more Cardinals have been tested. So if you're a baseball fan, and if you're not one of the supporters of wearing a mask, washing your hands, and watching your social distancing, you're never going to get to see baseball. So you got to be a part of the solution and not part of the problem. So
Sheriff was out this weekend. Sheriff Watson had his crews out, and they were in most of the liquor establishments in the county. And we're getting those reports. We're filtering through them now. Most complied, but a lot didn't. And so There are going to be different forms of action that are going to be taken based upon that compliance, and of course, the danger to the community. I mean, if you have a place that is packed full of people, the spread is very damaging to the public, and so we're going to make sure that that doesn't happen.
Well, and a question I have, Chairman, do you know of anybody that enjoys wearing a mask? I don't know of anybody.
The Lone Ranger's the only one I know,
And he was my hero.
and he wears his way too high.
Yeah, but it wouldn't have done no good. But I've never in my life understood it. If you want to get out of wearing a mask, let's all get together as Team St. Clair and let's get this thing behind us. And in my conversations I've had with the sheriff, he's taking it very serious. Like you said, they were out this weekend, and when you get those reports, and businesses beware, because if you are violating the policy and you are contributing to a health hazard. You've got customers or you've got staff members, and again, we've said this day after day, we want businesses to operate. We want you to be able to make money. But if you don't have healthy customers coming in there, or you have customers that are passing away, we added another death today, up to 155 of our county residents that has passed away since this started. I don't know anybody that's out there that's got a brain that thinks 155 deaths in this county is okay due to this COVID. So let's be a part of that solution and get this problem behind us.
And real quick, a member of Team St. Clair had a question about Code Red. They're trying to sign up, and they're having a little difficulty. They say that a password's required. Is that right? Or are they?
No,
are they,
it's on our Facebook page. All they do is click on there. A few questions they have to ask them if they want to call here.
do they need to give their emails or anything?
They don't have to. If they just go to alertstclair.com and sign up, they can sign up as a guest, and they don't have to give.
Sign up as a guest, and they can give their phone number if they
Verify
they
their
don't want to give
address,
any
correct.
other.
And they can always call our office if they're having trouble, and we'll help them out.
Yeah, have them call, and we'll have our IT people we'll get them on it, because we want everybody to get signed up on that, because we're going to be using that to continue to spread the word on how to fight this invisible enemy, and until at least we get that vaccine that can to help us out. So we're going to be back here momentarily with Cindy and Daisy to translate this into our Spanish community, and then we'll be back tomorrow with another special guest in your daily briefing at 3:30 tomorrow. Have a good evening.